All right, so we're going to go ahead and get started. So this is opioid awareness, and this lecture will be talking a little bit about opioids and how it has an effect on society and pain and all of that kind of stuff. So uh, definitely welcome. Appreciate that you have decided to join me for this talk. Again, I am excited to go through and talk about some of the information that we have about this, the power of functional and integrative medicine and chiropractic and how it can play a major role in the opioid epidemic. Um, a little bit about me. I am a board certified functional neurologist, chiropractor first, but a board certified functional neurologist. I also have a specialty in sports medicine. Um, I have a handful of other certifications and other things as well. And so, been elected or been voted best in Toledo a couple different times from a couple different sources. So, there's all that fun stuff. But anyway, let's get on with the topic at hand. So, opioids. Most people have heard of the term opioids, but they don't necessarily know what exactly that class of drugs is. Basically, it's things that are heroin and other things that are related to it. So there's different types of medications or drugs that are going to be in that. Again, there is fentanyl would be one example. Some of these things can be illicitly manufactured, and some of them are going to be legitimately from a pharmaceutical company. But fentanyl and other types of things can be again legal street drugs, and things can be in those categories. So different kinds of legal pain relievers would include oxycodone, also known as oxycontin. You have hydrocodone, which would be Vicodin. There's oxymorphone, which is Opana. Then you have codeine, morphine, and then fentanyl are some of the main ones. Again, opioids are going to be typically found within the opium poppy plant. And so anything that's poppy seed or anything like that, sometimes on drug tests will actually show up as being positive if somebody has like poppy seed bagels and stuff like that for opioids. But that is one of the things, because they're again going to have some consistency with it. So again, some prescriptions are made from the plant directly, and then other ones are going to be made in a lab where they're end up being synthesized in order to get the different chemical structures that are associated with it. So opioids react in the body in a couple of different ways. Basically, our body has the ability to make natural opioids, and these are going to be things that sometimes even chiropractic adjustments can have an effect with releasing some of these opioids. But basically, your body naturally produces opioids. It's something that works in the body in general. um, you have the interaction with the opioid receptors on different areas of the nerve cells within the brain and the nervous system. And when opioids attach to those receptors, they end up having the tendency to block pain signals that are sent by the body up to the brain. And they also have the tendency to release large amounts of dopamine. Again, dopamine is going to be something that gives feelings of euphoria, bliss. It can increase your motivation, and it can increase your concentration. And the combination of the decreased pain and all of the different effects of dopamine leads to a very strong incentive to take the drug. It reinforces the act. It makes the user want to repeat the experience. And again, because you want to repeat the experience over and over again, it ends up resulting in addiction. And then again, at the same time, the body has a tendency to adapt to dosage over time. And then that drug has the tendency to, you need more of it in order to get the same type of feeling. So all of those different things happen with opioids. Again, when someone is prescribed prescription opioids, again, they're they can be useful, but again, there is a very high risk of um, addiction associated with them. But in the short term, and again, when they're used as prescribed appropriately by a medical doctor, opioids have generally been considered safe and they can help relieve some traumatic pain. There are some harmful, like temporary effects. Again, the short term effects, like when somebody's on it. Again, drowsiness, confusion, nausea, constipation is something that people often get when they are on opioids. But again, the euphoria is one thing, but the issue that causes the problem with overdose is the slowed breathing. So again, basically one of the things that has happened recently is that there has been more calls to make it so that opioids are only going to be prescribed to patients with terminal conditions like cancer. um, you know, People have used them for multiple different things in the past, but you don't necessarily need them for a broken bone, even though they sometimes get handed out like that. So, and that is part of the issue. So, when it comes to how an overdose occurs, again, opioids are going to affect part of the brain that regulates breathing. So, when you end up having higher doses of opioids being taken, you can result in depression of the need to breathe. So, you end up having less air getting back and forth, and then that leads to hypoxia, which is where you don't have enough oxygen that goes to the brain. When you don't have enough oxygen going to the brain with the hypoxia, that can lead to coma. You can have permanent brain damage, and then obviously you can end up having death. So it ends up being even more of a problem when people are combining other medications or drugs with it. So things like alcohol and other types of sedative medications can increase the risk of that respiratory depression and then therefore death. um, and it there's other things with people who have medical conditions like HIV, liver or lung disease, or issues with depression. So there's a bunch of other things that kind of goes along with it. So when it comes to opioids and heroin, there's not really any difference. When you talk about prescription opioids and heroin, it's basically the same thing. It's just, maybe a little bit in the delivery method, right? Again, they're very similar in structure. They produce the same types of high. Some of the different levels of opioids kind of depend on how they are introduced into the system and how easily they can cross like the blood brain barrier to get into the brain to make the effects. Some of the less potent ones don't do a great job of crossing the blood brain barrier, which is why you don't get as much of an effect when someone's taking Tylenol 3 or something like that. But again, when it comes down to it, when it comes to medications and stuff like that, about 80% of Americans who use heroin um, end up they end up reporting, including people that are in treatment, they end up reporting misusing prescription opioids prior to using heroin. And part of the reason is that they might get some prescription medications, and again, that eventually might get shut down where they're not able to get it anymore, or it's actually, in some cases, it's cheaper to get heroin in some cases than getting prescription opioids, because again, people can end up getting um, you know, different types of access to it, or they end up being cut with other kinds of medications like fentanyl, which fentanyl it can be extremely deadly when it ends up being put in with some of the other kinds of medications. So there ends up being, or I should say, with some of the other drugs that are there. So again, people can switch to heroin instead of the prescription opioids, and again, that obviously is one of the things that causes problems. There's multiple issues with like people going to emergency rooms and things along those lines where someone might get a broken bone or something that's painful and they get prescribed opioids for a month. um and that's kind of problematic. So the way that opioids affect society is that the first thing is that, without talking about like the extremely sad part about it, is that there's some estimates that talk about the cost of opioid abuse in the US to employers. It can be estimated at about $18 billion in sick days, lost productivity, and then the medical expenses that are associated with it. But besides that, there's obviously the whole death part of it. So in the US, about half of all opioid overdose deaths involve a prescribed opioid. Now, when you start breaking down like overdose deaths, according to the CDC, are a little more than 900,000. So 932,000 people have died since 1999 from a drug overdose, and that includes all drug overdoses. In 2020, uh, 977 or 91,799 drug overdose deaths occurred within the United States. So the rate of overdose deaths increased from 2019 to 2020 by 31%. Opioids, again, when you start talking about like the synthetic opioids, are the main driver of all drug overdose deaths. So, of the opioid involved deaths, about 82% of them involve synthetic opioids, but overall, opioids end up being involved in 68,000 overdose deaths in 2020, which is 74.8% of all drug overdose deaths, which basically what goes to show is that this is obviously a major, major problem when it comes down to it. Without doing the calculations of the other things, another statistic that I had was in 2014, overdose deaths from opioid abuse reached an average of around 78 people per day, which ends up being more than 3 people per hour dying from overdose. So again, obviously there are a lot of different issues when it comes to um, opioid death and problems and stuff along those lines. So how do we get to this point? Basically, what it comes down to is that the number of people that are affected by chronic pain has been on the rise, and there are different attempts in order to try to keep up with the patient's needs, the demands for relief. Again, there is the overprescription of narcotic painkillers by medical doctors. Again, majority of medical doctors incorrectly believe that things like morphine and oxycodone, which are both opioids, are going to be some of the most effective ways to treat pain. And again, they can be effective at treating pain. They just don't fix anything. They just mask the pain and they create um, issues with doesn't fix the pain. It doesn't, correct the problem. It just creates issues with abuse and addiction. Again, many physicians explain that they were taught to view pain as a vital sign, and that's something that should be constantly monitored and aggressively treated. So this is one of those things when you get to the next slide, it'll kind of get into it a little bit more. But it used to be that people kind of like sucked it up. Pain was kind of like part of the deal. And it was understood that you would have pain, and it's kind of one of those things. But one of the main ways that medical doctors get their drug training ends up being from pharmaceutical reps. They obviously get a whole bunch when they're in school, but when someone's out of school, a lot of them, like a lot of the education for how medications end up being used end up coming from the pharmaceutical reps that come in and bring lunch in to the doctors on a regular basis. A lot of these medical doctors, um, the staff never has to pay for lunch because they're constantly being brought lunch by pharmaceutical reps. So it depends on the situation, it depends on the issue. But again, when you bring in lunch in on a regular basis, you have the tendency to have the ear of the doctor, and then they can find out what things that they've been prescribing and different stuff like that. So when you start talking about it, and this is where pain and profit kind of come together, in 1996, Purdue Pharmaceutical introduced the medication called OxyContin. And again, that's the opioid that is used to treat chronic pain of all different kinds. Again, it had FDA approval, but it was deliberately and falsely presented as a drug with a very small risk of addiction, even though it was known that it was addictive. And it was provided to patients free of charge for limited periods of time through a voucher system. So your physician could get a voucher, give it to somebody, they could get free treatment with it, and again, deal with addiction, get addicted in the meantime. So physicians, pharmacists, and other healthcare providers were aggressively marketed to, and they were encouraged to prescribe OxyContin liberally to everybody for every kind of pain that there was available. And then in a few years, OxyContin became the leading cause of opiate prescription overdose, and it had generated more than $1 billion in annual sales. So again, there's a big profit that's to be made with it. Again, Purdue's been hit with like thousands of lawsuits from different state and local governments. In 2007, Purdue was found guilty of criminal charges in all of this misrepresentation. There's things that can be talked about. There's a series on Hulu called Dope Sick, which is an 8 episode series, which it's actually done with actors. So it's not a reality type of documentary type of series, but it is something that basically talks about the whole progress and how this affects people. And that is a good show to get a little bit more information on. So one of the ways that we can address chronic pain is making sure that we are looking at opioids and how they're prescribed. And again, in 2016, there was a survey by the National Safety Council, and 99% of medical doctors that were surveyed were found to prescribe highly addictive opioids, and many of them ended up prescribing for longer than the 3-day period that was recommended by the CDC. Again, when you look at the results, again, 23% of the doctors came out and said that they prescribed at least a month's worth of opioids at the time. Again, this is in 2016, so not all that long ago. Years later, despite all of that, the different issues with painkillers that have been in circulation, again, studies really haven't shown any improvement in chronic pain. So there's medications that are out there in order to try to treat it, but it doesn't actually fix any of the chronic pain. It doesn't do anything to make anything better. It just temporarily has a tendency to change it, but then again, it creates addiction in the wake. So when it comes to back pain and painkillers, again, there's a lot of misinformation about the use and the need of painkillers when it comes to back pain. Again, more than 70% of medical doctors say that they have prescribed narcotic painkillers for the condition. And again, most people have had it. Back pain can be like absolutely awful, but for the most part, it's not something that people need when it comes down to it. Um, so one of the things that I would ask would be that you start considering chiropractic care. So again, many in the population have seen a chiropractor. Many don't know what we do. There's plenty of information that is out there. Again, like including on my website, which that would be besttoledochiropractor.com. I would encourage you to go there and learn a little bit more about it, but we'll talk a little bit about it here. So for musculoskeletal conditions, again, 1 in 2 adults are affected by a musculoskeletal condition like carpal tunnel or tendonitis or back pain or epicondylitis or neck pain, neck tension, different stuff like that. Many of the conditions can become chronic when they last longer than 12 weeks, and they can be associated with impaired physical and mental function and reduced quality of life. And many people have known somebody who has had one of these conditions. Headaches would be another thing that's kind of in there. And again, a headache can be considered chronic if you get 3 different headaches in a row, or if you've had multiple different headaches and things lasting over 12 weeks. And there's all kinds of different classifications when it comes to headache. But the Centers for Disease Control confirmed that about 17% of adults have experienced a migraine or a severe headache. And if they do get treated in an ER or from their medical doctor, opioids are often one of the ways that's used to treat them. So that is obviously not ideal. So alternative to drugs would be chiropractic and in general, like conservative care. Again, we're not using drugs, we're not using surgery when it comes to chiropractic. So chiropractic is the largest and it's the most regulated and is also the best recognized of all the different complementary and alternative healthcare professions. Some would argue whether or not we actually are alternative anymore because there is a huge percentage of the population that actually uses chiropractors. But a large number of people who have chronic pain, chiropractic care can be a drug-free, non-invasive, cost-effective alternative to opioid drugs. Providers in multiple different disciplines and throughout the healthcare industry are advocating the use of chiropractic care. There's also guidelines that consider that chiropractic care and other things that are like it should be used as a first line when somebody ends up having any type of musculoskeletal pain. So when you start talking about opioids and how it's related to it, is that there's a Yale study that was done a few years ago that talked about chiropractic care being able to contribute a significant reduction in the number of opioids that are prescribed in the United States. Again, some some sources will claim that using a chiropractor ends up reducing the likelihood of getting prescribed an opioid by up to 50%. So there's obviously a lot of different things when it comes to opioids about trying to have somebody get in, dealing with the opioid crisis. But many of the different opioid crisis issues ends up becoming after somebody has been addicted to it. What do you do? What kind of treatment programs are there, and other kinds of stuff like that. This is looking at things from the other perspective of is that if somebody ends up having pain, you don't need to start with opioids. You don't want to get them there. You want to try to basically, if the sink is overflowing, you want to turn off the sink before you start to try to clean stuff up. You want to stop the flow of new people getting involved with opioid prescriptions. So again, chiropractic care would be has been shown in evidence and in research that it is an effective form of treatment. Again, the effectiveness of chiropractic services makes it so that even the American College of Physicians have updated its guidelines in order to recommend that chiropractic be used first, as one of the non-invasive, non-drug treatments for both acute and chronic low back pain. And again, and you would want to look at drug therapies, medications, injections, those kind of things as a last resort. So again, the way that we look at it is that drugs aren't best just because somebody has been prescribed it, or that's, the reaching for a pill is the type of thing that people think might make them better. That doesn't necessarily make it true. In 2012, there was a study that revealed that patients that received chiropractic care combined with exercise for chronic neck pain were twice as likely to become pain-free versus those who were treated with medicine only. Again, this is following these the neck pain patients for 12 weeks. They found that 32% of those that received only chiropractic care became pain-free. 30% of those who were exercising became pain-free, and 13% that took just the medications became pain-free. So the combination of chiropractic and exercise was something that was beneficial for decreasing the amount of pain that a person had. Again, that's pain-free. That's not even talking about just decreasing pain. When it comes to different types of pain management, again, pain management deals with a couple of different types of pain. Like, so if you're talking about a pain management doctor, there's intractable pain and then there's chronic pain. Intractable pain is basically the term that it kind of came about with World War II. It's a definition of like a soldier who required morphine, which is an opioid, for constant pain. Again, that type of pain is typically going to be temporary. It's going to require surgery typically, or a lot of powerful medications, and that's not chiropractic care. Chronic pain, on the other hand, is something that can occur when someone has chronic pain or has intractable pain. And it can be something that can also develop over time without a specific type of traumatic event. Again, chronic low back pain, neck pain, headaches are all problems for which people often seek chiropractic adjustments. So the different things that can be done for it is that when it comes to chiropractic on how it works, again, the one of the ways that you can think about this is think about chiropractic as think about your body as an automobile. So if you're driving around, most of the time everything kind of seems fine. But over time, you can get little fender benders, or you can hit a speed bump too hard, or maybe slam on the brakes a little bit too fast. And again, you can get small little misalignments or small little problems. And again, over time, the damage might not be like immediately obvious, but over time, you can end up getting breakdown with these misalignments. And if things are misaligned over a long period of time, that can create a problem as well. So chiropractic care is basically the idea of trying to keep the bones and the spine in their proper relationship, making sure that the muscles are working properly in order to make sure that everything is running smoothly. Everything is trying to be as balanced as it possibly can. So these vertebral joints that we have in the body, they can lose alignment. And when you end up having problems with the loss of alignment, you can end up getting abnormal motion and movement in the spine. This is going to affect the way that the brain communicates with the body, and it can change the different firing patterns of chemicals within the central nervous system. It can also change the way that the body perceives its environment and perceives where the joint is. Again, if you don't do a good job of perceiving where the joint is, people have the tendency to have pain in that area. So it's one thing that is really common, that people that end up having chronic pain, if you do testing to kind of figure out like where, if they know where their neck is in space, um, neck pain patients have the tendency to not be able to know where their neck is, in relationship to the rest of their body. Like if they're looking further right or straight in front of them, or up, like if they were blindfolded. There's different studies that they use with lasers in order to kind of demonstrate that kind of stuff. But again, the idea is that you reduce the interference of the joints not lining up or knowing where the body is, and you can help return the body to its regular order and kind of get it back into harmony. Again, one of the best ways to do this is obviously visiting and consulting with a chiropractor, again, like in our office. And again, you can end up having symptoms that are associated with it. And, the symptoms, along with, your history and along with your exam, can find different things, can figure out whether or not you need to be adjusted, or you need exercise, or you need other types of soft tissue work as well. So there's a handful of different things that can happen with all of that. So, um, other ways that you can reduce pain, again, bodies change and you'll go through different changes, obviously. You want to take into account the fact that you will have that exercises are one of the things that can help promote stability, strength, and balance. Again, if you strengthen your core, that can allow your spine to achieve a neutral, healthy posture easier than obviously if you're not in balance. Strength training can also help build the muscles and support your bones, again, helping to build resilience within the system. Exercises that involve balancing, like yoga or Tai Chi, can also help with alignment. And you can also prevent having falls down the line, which can also contribute to chronic pain and, broken bones and things along those lines. And again, exercise is another thing that will boost your mood. So exercise is an excellent way of helping to affect multiple different things, since our bodies are actually made to move. Another thing that you can use to help kind of reduce your pain is to maintain a healthy weight. Again, having some degree of being overweight, you can end up increasing the stress on your joints and the muscles. And again, if they're already misaligned and then you're maybe heavier than what you should be, that is going to, magnify the amount of dysfunction that you would have. So again, you can lose weight, but even if you lose the weight, you still are going to have issues if you have alignment issues as well. So that is basically that. This is a quick little presentation. So appreciate you taking the time out of the day to join us. Um, Again, hopefully that you see that there's a bunch of different information out there about painkillers, and about how painkillers are not necessarily the option of what you want. If you get offered a painkiller, that is, I would think long and hard before I would fill that prescription. So that's about it. Again, my name is Dr. Bryan Royer, and this is about Harmony Chiropractic Center. Take a look at our website at besttoledochiropractor.com. You can also check us out on Facebook and Instagram and all that other kind of stuff. And that's about it. So thanks for listening, and I will maybe see you in another webinar at some point. Thanks. Bye.